All right. Hello, everyone. Today I have Dr. Amanda Olsen on the podcast. Hi, Amanda.
Hi, thanks so much for having me.
Of course. Can you give the listeners a bit of some background information on you, both professionally and personally?
Absolutely. So my professional background is I'm a physical therapist that specializes in pelvic floor rehabilitation. So I treat patients of all genders and backgrounds and ages for a variety of different issues that come up that are highly sensitive, from urinary incontinence to constipation, pelvic pain, and people with IC. And then I also am the president and chief clinical officer of Intimate Rose, which is a company where I create devices to help empower people to manage their symptoms on their own and to be able to reach their goals and just be participating in all the things that they want to be able to do. And then personally, I'm a mommy of two little boys that are 5 and 8, and I enjoy running and doing Pilates and just being outside.
Love that. So I'm very curious, how did the Intimate Rose company come about?
Yeah. So as a clinician, I've been practicing for 14 years now. The business has been in place for about 6 years. And what I was recognizing just being one-on-one with patients is that, we're doing a lot of important work in the clinic. We're doing a lot of manual therapy and exercises and giving people things that they can be working on at home. And there weren't a lot of products on the market that were achieving the goals that we wanted. And so we started with one product that was geared towards urinary incontinence. And the whole aim of all the products really is to make them the most comfortable. So we use a medical grade silicone that has a unique finish on it that's very, very soft and easy to use. And we use colors that are really cheerful and bright and don't look medical or scary. And so that was the goal with creating the product. So we started with the first product and then branched into pain products to help people ultimately be independent. As a clinician, my goal for my patients is that they are managing their symptoms, feeling great, and not having to attend appointments all the time. My goal is honestly to get them to a place where they don't need me, or maybe they need less frequent check-ins. And so the products are geared towards giving people a means of managing their pain or their symptoms on their own.
That's amazing. I love that story. And I even have one of the ones, and everything that you just said. Yeah, it's cheerful, it's soft, it's very as welcoming as it can be.
Yeah.
I definitely want to talk to you more about your products, but I wanted to ask, is it just you, or is there multiple people on your team or in the company?
Oh, sure. Yeah. So I have a business partner, and then we have a pretty big team now. In 6 years, we've grown a lot. So we, make use of designers, and I mean, I design the products themselves from a medical standpoint, and I choose the colors and whatnot. But we have people that create our images and run the technology side of the business and all of that. So I'm very grateful for our team.
Yeah. Okay. And I know a lot of the listeners have questions about dilators, wands, etc. My first question is, what's the difference between dilators and wands, and is there one?
Yeah, absolutely. That's a great question, and one that I get a lot. They have different functional purposes. Oftentimes, people will need both, but sometimes they'll need one or the other. So, starting with the dilators are shaped like a cylinder. They start very, very small. They start about the size of my pinky, and they get to be roughly 8 inches long and of a thicker diameter. So we have 8 dilators that just slowly and gradually get longer and wider. Dilators are for people that are having issues tolerating penetration in through the vagina or through the anus. So these are people that maybe have pain with tampon use. They cannot tolerate a speculum during their medical exam, or maybe they cannot tolerate penetrative sex. A lot of times, these are people that have had cancer treatment, radiation, surgery to where there's some scar tissue or some restrictions, or they're people that have a reflexive guarding contraction of the pelvic floor muscles that makes it just really difficult for penetration to occur. So the purpose of the dilators is to help train the brain actually and the pelvic floor to communicate and coordinate better to be able to relax and open during those penetrative activities like using the tampon, having the medical exam, or having penetrative sex. So they are used to gently train the brain to relax when something is penetrating. The wand, on the other hand, is used for people who have deep tender points or trigger points or fascial restrictions within the pelvic floor itself, oftentimes in the front and on the side. So the wand is kind of shaped like the number 5. Each of those curvatures are very specific to help a person reach a unique angle in through the pelvic floor. So again, they may be a person that has issues with penetration, and maybe they are working with the dilators. It may be that they can tolerate the penetration, but they have pelvic pain. And particularly people with IC tend to have a lot of guarding and restrictions in the pelvic floor muscles in the front of their pelvis, around that bladder and around the urethra. And so they can use the wand to go in and gently release those tender points.
Okay. So how does somebody go about choosing a product that would be right for them?
Usually my first and foremost response is it's always important to get a thorough and complete evaluation by a pelvic floor physical therapist or occupational therapist. In an evaluation, that clinician is going to be assessing your posture and your breathing and your pelvic floor muscles for all of the combined effects as to what is driving the pain to help better create a plan of care. And so oftentimes they're going to be determining if you have tender points in the deeper walls, or to what extent your vaginal opening can coordinate and drop to open for that penetration. So my primary recommendation is always to get that evaluation and be working one-on-one with a skilled clinician. For people that don't have access or that can't do that, we have a lot of guides on our website. Namely, I would say if you're not able to tolerate a tampon, it's a good idea to start with the dilators. And I have a guide that comes with it and videos on the website to help guide people through that initial process. If you're able to tolerate all those things and you have tender points, then it's usually a safe bet to go with the wand. There's 3 different types. We have an original one that just as it is, and the turquoise one is a vibrating one. Vibration helps to improve circulation, blood flow, and to help relax the pelvic floor muscles. So people that have long-standing symptoms, long-standing muscle spasms, chronic back pain, hip pain, all of that tend to respond really well to that vibrating wand. And then the yellow wand is a temperature therapy wand. And that tends to be great for people that respond really well to cold packs or warm packs, particularly people with IC that have kind of an inflammatory or chronic ongoing disease process in place. Interstitial cystitis, endometriosis, IBD, the inflammatory bowel diseases. Those people tend to really like that temperature wand. So from there, a person can kind of decide based off of their symptoms if they are not able to see a pelvic PT or OT.
Yeah, I love that you have resources for people, because not everybody can go to pelvic floor physical therapy, or they're trying to get in, but there's a really long wait time, or maybe they don't have the finances to afford it. So I think that's really great that you have all of those resources. I've checked out some of your videos in the past, and they're really informative. And, your PT can explain and teach you exactly how to use it, but sometimes you might need a refresh on that education. And it's awesome that you have different types of wands. I actually didn't know about the temperature one. That's so cool.
I'll show it to you. I know the listeners can't see it, but
so it looks just
yellow.
Just like the wand that I have.
Yeah, they're all the exact same dimensions. They just have different features. Yeah,
okay.
they're all the same size.
Got it. And I was always wondering about the vibration one, because back when I was in pelvic floor PT with a different person than I'm seeing now, they were telling me about your product, and they were like, they have an option that has vibration on it. And then I was like, oh, that's weird. I didn't really know what that meant. And I was like, that kind of sounds like I don't want to say sex toy, but it sounds more like that. But then she's told me about it and she educated me, and I was like, oh, that makes so much sense. So I'm sure you run into that quite a bit, right?
Absolutely. Yeah, absolutely. But when you think about how we respond to massage and, there's the vibrating chairs at the mall where you can, get the knots worked out of your neck and your back, the pelvic floor is the same. And vibration in and of itself does stimulate that blood flow and relaxation. I think, there certainly are sex toys that vibrate. I mean, they're actually called vibrators. So for that reason, I think it does create some confusion. Certainly someone could use the wand in that way, and that's not a bad thing, that's totally fine. But the intended use of this particular pelvic device is to help with healing and to help with people that have chronic pain. And we have gotten the most amazing feedback on that vibrating wand. I'm so proud of it. It's been a life-changing device for so many people.
Mm-hmm. And it seems like I've only ever heard of the Intimate Rose wands. Do you guys have a special patent on that no one
We
else
do.
can? That's
Yes.
awesome. Wow.
Yes.
Good for you. That's really cool. Is there any like research behind it, or is it just kind of you put it out there and you're hearing about all the feedback and kind of going from there?
No, so with the other devices, there's a ton of research. Vaginal weights and dilators have a lot of evidence behind them. With the tender point wand, the research namely speaks to the presence of trigger points or tender points and how they respond under different medical treatments so far. So far, research has looked at like acupuncture, needle type injections, injections that physicians do in office that often contain Botox or lidocaine or other relaxing agents in them to shut down trigger and tender points. And those can be really great for some people. And for other people, they're not a candidate or they are not interested in having needles injected into that area of their body. And so the wand was created as a means of addressing that and just as a creating a means of reaching those deep tender points for people. So when we looked at the shape, when I was creating the shape, it was really important to me that that front hook be able to get underneath the bladder for people that have tender points in the muscles that surround the bladder and the urethra. And then the second hook is designed for people to be able to reach the far sides of the pelvic bowl. So it's based on anatomy and it's based off of existing medical models.
Okay, awesome. And do you recommend people using a lubricant when they use a wand or a dilator?
Yes, and generous amounts. So water-based lubricant or a natural oil like a coconut oil or avocado oil, it is BPA-free medical grade silicone. So you unfortunately cannot use a silicone-based lubricant. Those two do not get along together. But a water-based lubricant, I usually recommend at least a tablespoon, a generous amount to just give a slip to the product and to help ease any discomfort with it.
Okay. And this might be a silly question, but how do you recommend people like wash them?
Oh, basic soap and water. So mild hand soap, and then patting dry with a towel. We are currently in development of some different types of washes because sometimes people like to have something specific to that, but it's all been cleared for basic, just the same way we're washing a happy birthday with our hands. That holds true for the devices.
Okay, awesome. And I remember recently, was there an issue with getting your product sold on websites like Amazon?
There's a big problem. Yeah.
Yeah, can you tell me more about that?
Yeah. So Amazon has different categorizations and it actually creates different interfaces for the user. Most of us don't know this because when we go in and we say, I need more ballpoint pens. We enter in pens and, the listing comes up and we're in the normal Amazon interface. For certain, they do have adult products on their website. However, the user must be 18 years of age or older. And when you enter that section, the marketing images are explicit. They are often sex toys, as you just touched on, and you can buy sex toys on Amazon, but it's a different interface and you have to attest to being 18 years of age or older. What they basically stated a few months ago was that they were going to start classifying vaginal weights and wands as adult products. The problem with this, so as I mentioned, if somebody wants to use our wand for sexual things, there's nothing bad about that. We are very sex positive. We want people to be enjoying themselves and living their best life. But our devices are medical devices. And in fact, we are FDA compliant across all of our products. And people that have urinary incontinence or pelvic pain may also have a history of sexual trauma or abuse, or they may have had this device recommended by their doctor and they are, because of spiritual reasons, not in alignment with adult products. So if Amazon classifies our products as adult products, that means that those people that have maybe been raped or had a history of sexual trauma or abuse, and that's the driver of their injury to their pelvic floor or their chronic tension, they now have to enter an adult website and scroll through explicit images in order to find their medical device that was recommended to them by a healthcare professional. And that is highly traumatic to those people that have a history of abuse. And it's highly unpleasant to the people that that's not part of their lifestyle. That's not part of their spiritual paradigm. So we did a petition against this. We had 75,000 signatures. And Amazon had not indicated that they were going to change. As of this point, our products are still visible on that main interface. We are so thankful. So we don't know when or how those changes are going to take place. But for this reason, we always want to direct people to purchase our products off of our website, off of intimaterose.com. The imagery will always be very pleasant and non-explicit. We take a lot of pride in how we present our products and how we take care of people, and we want people to have a safe user experience. So that is the story of classifications.
Crazy story. And I remember a couple months ago reading about it, and I obviously signed your petition and shared it, but that is just wild to me, how it's so helpful. Your product is so helpful for so many people. And yet, it's just getting classified or grouped in with other adult things like that. So, good for you for fighting back. When you ship your products to people, is it in like a discrete package?
Yes, absolutely. Yeah. It's in discrete packaging. Nothing, it doesn't even say like our company name on it, on the return, on the, on the label. So it does ship discrete in case in case somebody sees it and they don't need to know what it is.
Right. It's actually really funny. There's a person in my program that on our group call last night, I told her that I was going to be interviewing you for this. And she told the story about how she bought a wand through her parents' credit card, and the dad saw Intimate Rose and he is like, "What did you just order?" And I thought that was so funny. Luckily they were all very lighthearted about it, but I could just picture that happening with my parents, and I would just want to hide.
Oh, sure.
Yeah, such a funny story.
Boy.
And I know you wanted to talk a little bit about using these tools for endometriosis. Can you briefly talk about that a little bit?
Yeah, absolutely. There is a high percentage of people that experience both IC and endometriosis as part of the evil twins paradigm. If we throw in the ball, it makes the evil triplets, as if one diagnosis wasn't enough.
Right.
But it is really common and prevalent. And so for people with endometriosis, they tend to experience that guarding reflex as well in the pelvic floor as a response to that pain. And that creates chronic shortening and tightening of those muscles. So if you think about, if all you did was sit all day, your legs and your back would get very, very tight and very, very sore. The pelvic floor muscles respond in the same manner. They are muscles just like everywhere else. So for people that are experiencing both IC and endometriosis, the wand can make a world of difference in managing that chronic tension and helping to decrease ongoing pain cycles. We did create the temperature therapy wand in the yellow color in honor of endometriosis. So it's in the actual Pantone color is endometriosis yellow. And so that temperature therapy can be really beneficial to people with those inflammatory conditions. And then additionally, managing with lifestyle, it's the same as IC, right? We're talking about finding an exercise mode that brings you joy, that feels good on your body, that's stimulating your heart and your muscles without overstimulating and causing a flare up. So that looks so different from person to person. And I just want to encourage people to continue in their plan that works for them and to find a good pelvic health rehabilitation specialist that they connect with as a person. We're all different as providers and we're all different as people and as patients. And so if people have tried pelvic therapy in the past and just haven't quite found their match, I encourage them to keep looking. It's hard enough dealing in the medical model with finding a physician that takes you seriously, listens and follows up and is putting you on the right path towards remedies to manage the condition. But it goes likewise with rehabilitation as well.
Mm-hmm. Absolutely. Yeah. And I personally witnessed that. I've seen 4 different pelvic floor physical therapists and they were all so different. So you're absolutely right. You need to find one that you vibe with and that you're confident sharing your intimate details with, because it's a very intimate experience.
This is not the same as like a shoulder. And pelvic therapy is not a no pain, no gain type therapy. And it's very vulnerable. I mean, it's a very vulnerable position to be in. So you got to find someone that you get along with.
Absolutely. So now I want to pivot and ask you more about the supplements that you have been offering. So I noticed you just came out with an aloe vera supplement. Tell me about it.
Yes, we are so proud of this. So it's freeze-dried aloe, and we actually included additional D-mannose. The aloe has been around for a long time in the capsule format to help people with IC. Mm-hmm. Anecdotally, patients of mine that have IC that have taken aloe supplements have just felt better when it's ongoing every day, just on board, as part of their self-care regimen. D-mannose is included because D-mannose helps to prevent bacteria from sticking to the walls of the bladder, which can help prevent or manage people that have chronic UTIs. And oftentimes people with IC can fall into that kind of pitfall cycle. So we are very proud of it. And we launched it about a month or so ago.
So is it in the capsule form also?
Yes. Yeah. So it's in a vegan capsule.
Okay. So it's your typical capsule supplement. And how many of those are people recommended to take a day?
3.
Okay.
So we used a very high concentrate of the aloe. So it's 3 of these. I know that people can't see, but I'm showing you.
Yeah.
It's 3 a day.
Okay. Yeah. It's like your average capsule. Okay.
Yeah.
And you guys obviously process it to take out all of that stuff that might cause any GI distress or anything like that.
Yes, exactly. Because again, touching on the high prevalence of people that experience bowel disruption. And I, for one, have all the food allergies. And so when we are creating these, when we're working with our pharmacy team to create our supplements, the physical therapist is not formulating these. We are working with the pharmacy team. It's very important to me that every product is gluten-free, soy-free, corn-free, all the frees, because that's where I live. I live in allergy land.
Yeah, that's great. And how long do you recommend people take those for?
At least 3 months to get an established ongoing presence of the aloe in place to where they can start to recognize some of the differences and changes. When we think about being in an ongoing inflammatory state because of the disease process or because of the nutritional aspects, which of course you are the expert in. We know that it's not going to be a couple doses. It's going to be the ongoing changes that we make. And so at least 3 months, and then if not indefinitely, as I mentioned, just, part of the daily vitamin intake that they have.
Right. And yeah, aloe is one that, like you said, takes a couple months to kick in. And I feel like there's other supplements where people might notice a difference in a few days. So it's just so different across the board. How has the response been since you launched that product?
It's been good. People have given us some really great feedback. I think a lot of people are very excited to have the presence of the D-mannose because they were taking like a separate D-mannose and they were taking an
Right.
aloe and they're taking the probiotic and they're taking the vitamin D and they're so
Yeah.
I think having it all rolled into one has been really nice for
Yeah, no,
people.
that's fantastic. I didn't realize that your aloe had D-mannose in it. That's so cool. What made you think of
Yeah.
that?
We use D-mannose in our other probiotic, and we've gotten great feedback on that. And so when we were making this and wanting to address the bladder holistically, it was a no-brainer. It's just a matter of, how does the pharmacy team work to get it all into the capsule without people taking a million pills per day. So we were familiar with its actions and the feedback that we were getting from people on our probiotic, and so we were excited to include it in this one.
Cool. Yeah, I know there's research that's going on. I think Desert Harvest, that company is involved in some type of research trial. Are you familiar with that?
Yeah, I know that they had done some third-party work prior. I'm not familiar with what's going on now.
Yeah, me not so much either, but I'm interested to see the results of that. And I think the aloe is very promising for the IC community. So it's really great that they have more than one option to choose from,
Yeah.
between brands. I think that's so cool. So what other supplements do you guys sell?
We have our probiotic that has a long-lasting capsule. So one of the interesting things about probiotic that not a lot of people are aware of is that a lot of times if you're buying a lower end probiotic, the acid in your stomach can break it down, and the good bacteria that are included in the capsule don't survive the entire track to get to the intestines where it's most needed. So we were very pleased with our results on using a longer lasting capsule to ensure that it gets down there. So we have the probiotic. We also just launched a Vitex supplement for people that are having painful periods, hormone changes, headaches. It's from the chasteberry. So the Vitex is a natural supplement to help people regulate menstrual disorders. And we also have inositol for people with PCOS. So inositol has, there's other brands on the market previously. Again, we worked with the pharmacy team to make it very, very clean. And we've gotten great results from that. We worked with a group of PCOS advocacy groups when we were getting feedback from that, and they were very pleased with it as well.
And for anyone listening who doesn't know what PCOS is, it's polycystic ovary syndrome. I feel like if you don't know about it, you might need a little bit of background on that. But I didn't realize you guys helped with different conditions. So that's really cool. I also saw something on your website about boric acid suppositories.
Yes. Yeah, we do have that available on our website. So different people seek different solutions for chronic bacterial vaginosis. And so that's one of them as well.
Okay, awesome. Is there anything else that you guys offer that we didn't talk about yet?
In terms of the devices, we created a handle for dilators that is unique. It's the only one on the market that can address silicone dilator use. So it adds an extra extension for people that need a little extra
Oh my
ergonomic
God,
help.
Amanda, you just opened my eyes to a solution to my problem. So let me tell you, in my experience, the reason I don't use a dilator or a wand is because I feel like my arms are so short that I am straining to do it. Is that what that can help me?
Yeah. Yeah, it's a handle. You get a whole nother foot.
I didn't even know that this existed. When did you come out with this?
This one's been around for about 2 years.
I can't
So on the
believe I haven't heard of it.
yes, we're super proud of this. So the handle comes with 3 bands, and you just load the dilator onto the handle, and then you
I'm
can use
ordering
it for a
that
little.
right when we log off this. That's so great.
I'm
Are
so glad
there,
I thought to tell you.
yeah. So there's obviously other people like me that have issues reaching.
Oh yeah. Oh yeah, absolutely.
Wow.
People come in all different shapes and sizes, and people have different dexterity, ability to use their hands to do things. And sometimes people want emotional space from their body, and it's just really helpful to have that kind of extra lever arm
Mhm.
to be able to
Right.
use with the dilators.
Right. And have you, in your experience, had patients or, have you talked to anybody who has like a partner or a spouse that helps them do manual therapy at home?
Yes, absolutely. So it's always down to the individual and the couple as to like what their goals are and what their experience is. But absolutely, I have partners come into clinics so that they can learn what exercises are going on, and learn from me as a clinician as to what their partner is experiencing. And then they can be trained in helping with the dilator process. So it can be isolated as like at home therapy, and it can be used in latter stages as kind of like a warm up together of building that bond and creating some intimacy, and then transitioning into intercourse. So yeah, I've seen all of the above. I've had patients that are really like, I don't want him to see what's going on behind the curtain until it's a finished product.
Mm-hmm.
And they want their partner being no part of the rehabilitation process. And I have people that bring their partner in day one, and that partner is at every appointment and is their cheerleader and is just working together. And so it's about the individual and about the couple.
Mm-hmm. Okay, that's really cool. I was just personally curious about that. So, for somebody who is on the fence about maybe purchasing a dilator or a wand, what advice would you have for that person besides getting evaluated by a pelvic floor physical therapist?
Sure. I would say, speaking to our website and brand, visit our website. We have a guide section where you can read what the basic guides for each product are. And then if you go to our blog, there's hundreds of videos and articles on every different diagnosis under the sun. There's blog articles on IC, on endometriosis, pelvic pain, urinary incontinence, constipation, all the above, and just read up. And it's like gathering the information. There's no like end timeline where it's like, if you don't act now, your pelvic floor is forever sealed shut.
Right.
It's always part of the journey. And so I think the more you just look at it from afar, like on the screen, the less threatening it is. And then when you decide to purchase, like, and it comes into your home, get familiar with it on your skin. Like, for example, if you're like really having anxiety or having some really strong emotions about a dilator or a wand, which is really common, by the way. Like, I feel like people, first of all, need to give themselves some grace. All of those emotions are very common. And a couple of ways to work through that once you've made the decision, like you've educated yourself, you need it, you are feeling ready to start that process. Start by just settling into an easy breathing process and feel it on your arm. So place it onto your forearm. That's a non-threatening place for most people. And just start by looking at it and breathing with it and feeling the touch on your skin, and start with some self-talk of, this is a dilator, it's here to help me reach my goals, or whatever works for you. But it doesn't have to be like, it's here, start rehab right now, you got to put this thing in and try to figure it out. There's like a plane trying to take off. There's like a ramp, and you can build momentum and build speed by educating yourself and just getting familiar and comfortable with what the device is.
Mm-hmm. Baby steps.
Yeah, got it.
Yeah, that's great. So does your company ever have sales, or is there any sort of like coupon codes that they can use? I know my pelvic floor physical therapist had a coupon code that really helped me save some money
Yeah.
when I was starting out.
Absolutely. We do run some sales sporadically. I will get you a code
Okay.
and we can maybe link it to this episode to
Absolutely.
offer your listeners a discount and all of that. Right now, the Aloe is going through a major sale on our website. I think we are doing 40% off right now as of the date of this recording. But we can, maybe post that on social that we're doing a big sale on the Aloe right now to help spread awareness during our launch. But yeah, we'll get you a code and make sure that people can get a discount.
Yeah, sounds good. I will definitely link that in the show notes. But yeah, I just wanted to say thank you so much for coming on to the podcast. It really means a lot to me and the IC community. So thank you so much.
Oh, thank you so much for having me.